So I want to talk about the micronutrient deficiencies that are created when you actually take a drug. This is one of those things that no one's really talking about. Your doctor's not telling you about this. It's not listed in the label, but it's something that's occurring. And the problem is that as you create these nutritional deficiencies, you create symptoms that then are treated with a drug. So it gets really confusing. You don't know what's causing what. Okay, so antacids. When you take antacids, there's several types. If you're taking like an H2 antagonist, it creates an iron deficiency, B12, vitamin D deficiency, calcium deficiency, zinc deficiency, and a folic acid deficiency. A lot of these nutrients function to help repair DNA. So that's really important for longevity. And then we have proton pump inhibitors. You get a magnesium deficiency and a B12 deficiency. If this goes on too long, that can create all sorts of severe neurological problems. Antacids in general, like Rolaids, for example, that use calcium, neutralize the stomach, and now you're going to have all sorts of mineral deficiencies. It could be zinc, it could be calcium, potassium, magnesium, all the minerals. They just can't get absorbed. Also B12 and protein. Antibiotics not just destroy your good bacteria, but it creates a deficiency in calcium, magnesium, iron, K1, because the microbes actually make K1, B1, 2, 3, 5, 6, 9, that's folic acid, and B12. Antidepressive medication. You become deficient in Q10, which is really important in repairing the heart. Magnesium, which is a cofactor in about 600 different enzymes. B2, B6, B9, and B12. Antipsychotic drugs create a B2 deficiency and a vitamin C deficiency. Not to mention, there's actually a lot more too. I just put the main ones. Antihypertensive, drugs that reduce blood pressure. So we have ACE inhibitors, which deplete zinc, magnesium, and potassium, which, by the way, when you take potassium and magnesium, it helps you lower blood pressure. Okay, beta blockers, coenzyme Q10 depletion, vitamin D deficiency. Calcium channel blocker. So it's not only going to block calcium, but folic acid and the B complex. Then we have anti-cholesterol medication. I'm mainly talking about statins. This is a big one. It's going to create deficiencies with vitamin A, D, E, K, CoQ10, EPA, DHA. These are the omega-3 fatty acids that make up the brain structure, and it's intimately involved with the brain function. Because with statins, they're blocking the production of cholesterol. So you're going to have a problem with making cell membranes, hormones, testosterone, many things. Okay, corticosteroids. You'll have a deficiency of calcium and magnesium, and B1, by the way. Then we have metformin, which is for type 2 diabetes. It creates a deficiency in B12, B1, and B9. And the other problem with metformin is that it has a black label that it can produce lactic acidosis. And guess what the remedy for that is? B1. But if you don't have any B1, it can build up and can create a problem. Diuretics. It's a big one because diuretics are used to get rid of fluid, and they're given for people that have high blood pressure. So it starts to block magnesium, potassium, zinc. And if you take the diuretics that are potassium sparers, in other words, they don't deplete potassium, you'll get a buildup of calcium. So it throws off your electrolytes. It'd be interesting to see if you did take electrolytes, if you had fluid retention. That's because potassium and magnesium help to eliminate excess sodium, and they help balance your fluids, but they don't really look at that. Okay, hormone replacement therapy depletes B9, which is folic acid, magnesium, B6, and B12. And this is just the tip of the iceberg. We're not even talking about other side effects. Anyway, if you're taking in these medications, you better be taking these nutrients. Thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.